Hi. Today I will be talking about what it is exactly that I do, because people invariably, when they find out that I'm a doctor of Chinese medicine, they say something like, "Oh, that's really interesting. That's acupuncture, right?" And yes, it is acupuncture, but it's also a lot more actually. And I thought it'd be interesting to give a little bit of an example of something that I typically see and how I would address that as compared to a doctor of Western medicine. So something that quickly comes to mind is like acid reflux, digestive issues with acid reflux. It's something we see all the time. And the typical Western approach to that is to say, oh, you must have too much stomach acid. So we'll give you a pharmaceutical that will reduce your stomach acid, and then your acid reflux probably will just go away, right? And usually those drugs are only supposed to be given for some weeks, right? But invariably people end up staying on them a lot longer. And my perspective is actually totally different. There are a few different things that can cause something like acid reflux, and none of them have anything to do with too much stomach acid. In fact, it's often too little stomach acid that is keeping the stomach from being able to totally digest the food, and then it sits in there a little bit too long and it starts to kind of come back up, and that's why that pain happens. So that's one possibility. It could also be because this person's had some kind of an emotional shock and their nervous system got really activated, and that can actually disrupt, this is going to sound weird, but it can actually change the position of the stomach in the body. And if the stomach positioning is shifted just so, it will actually keep the stomach from being able to function properly. So what we would do about that is actually manually, very gently, move the stomach back into position, and then the acid reflux often just goes away. Another possibility for something like this is, in a Chinese medicine perspective, we have to digest our experiences and our emotions as well as our food. And if someone's had, again, a shock to their system, perhaps they've just lost someone that they love very much and they're grieving, or they've experienced some kind of a trauma and their emotions have just been dysregulated, and maybe they're not even sleeping well. There could be a whole spectrum of things that would go along with this picture, but invariably they disrupt digestion. And with something like that, the whole digestive system can be upset. And this can actually go on for a long time. This could be months, it could be years. So with something like that, we would go in usually with Chinese herbs and acupuncture and potentially some body work as well to check and see what things might be stuck, what things might need to move, and do a whole systems examination of that with this person, understanding their emotional state and where their body's holding tension, what other systems have been disrupted, right? Like I said, maybe their sleep, it could be their respiratory stuff. They might have something going on with that. At any rate, after looking at the entire picture of what this person is going through, we would look to understand what it is their body has been attempting to do that it's struggling to do, and we would look at how we can support that process in happening. So it's always looking for the way the body is trying to come back into a state of health and balance. We're not looking to control symptoms, although typically that's part of the treatment, is helping with symptom reduction, right? We don't want to have acid reflux, clearly. So how can we bring this person's body back into a state of calm and peace and comfort and ease so that their system can function optimally again? So Chinese medicine ultimately is about helping people to reclaim their sense of wellness and their overall health so that they can feel better without drugs and medication. Yeah, that kind of sums that up.